I am Vishal Ghoderao, student of Shivajirao Junior College of Pharmacy, Asangaon. I am here to give you information on the topic the pyridine scaffolds, its diverse biological action, guided by Professor Manjusha Sanap, Principal Dr. Nitin Mohiri sir. Abstract: Pyridine derivatives have a huge demand because they have shown tremendous pharmaceutical and agricultural uses. Also, they have shown large and emergent biological activities such as in poisoning, antimicrobial, anti-diabetic, anti-cancer, anti-convulsant, anti-anthelmintic. By keeping it in consideration, we have summarized the activity of pyridine scaffold acting against poisoning in this review. Introduction: Pyridine is a heterocyclic compound which is colorless to yellow liquid with a chemical formula C5H5N. It is also known as azine or pyridine. The structure is like benzene with one methane group replaced by nitrogen atom. It has conjugated system of 6 pi electron like benzene that are delocalized over the heterocyclic ring. It has sour, putrid and fish-like odor. It can be synthesized from ammonia, formaldehyde and actaldehyde, or it can be made from crude coal tar. Other features: it is weakly basic and is miscible with water. It is highly flammable and when inhaled or ingested it becomes toxic. Some symptoms when exposed to pyridine are nausea, asthmatic breathing, vomiting, headache, laryngitis and coughing. It is widely used in the precursor to agrochemicals and pharmaceuticals. Structural characteristics: aromatic compound which have 5 carbon atoms and 1 nitrogen atom. However, the nitrogen's lone pair of electron is sp2 orbital. Aromatic compound which have 5 carbon atoms and 1 nitrogen atom. However, the nitrogen's lone pair of electrons is a sp2 orbital orthogonal to the orbitals of the ring. Hence, it is not involved in maintaining aromaticity, but it is available to react with protons. Thus, pyridine is basic. Biological activities as antidote: antidotes for irreversible acetylcholinesterase inhibitor, organophosphate. These are absorbed from all sides including intact skin and lungs. They are hydrolyzed as well as oxidized in the body and little is excreted unchanged. Formation of oxamine: reaction of hydroxylamine with aldehydes or ketones affords oxamine which possesses the desired nucleophilic oxygen atom. A pyridine ring was considered an attractive carrier for the oxime function because such groups are common in number of biological systems, indicating a possible low order of toxicity. Furthermore, the 3 readily available positional isomers of pyridine aldehyde can be easily converted to oxamines. Finally, the nitrogen atom of pyridine ring can be converted to quaternary ammonium salt by treatment with methyl iodide. The cationic charge will be expected to increase affinity of the compound for the anionic binding site of the phosphorylated acetylcholine. Cholinesterase reactivators: oxamines are used to restore neuromuscular transmission only in case of organophosphate anti-CHE poisoning. The phosphorylated CHE reacts very slowly or not at all with water. However, if more reactive OH groups in the form of oxamines are provided, reactivation occurs more than 1,000,000 times faster. Action of drug containing pyridine as an antidote: pralidoxamine. In 1955, Wilson and Ginsburg in the US and Childs in England research published independently on the efficacy of the compound 2PM iodide as a reactivator of phosphorylated cholinesterase. The 3 isomeric pyridine aldoxamine methiodides were synthesized and biologically evaluated. Of this, the most effective is the isomer derived from 2-pyridylaldehyde. This compound, known as pralidoxamine chloride, currently is the only available agent proven to be clinically effective as an antidote for poisoning. B. Antidote for isoniazid. Isoniazid was introduced as a treatment for the tuberculosis in the 1950s. It was soon found to cause peripheral neuropathy, which was established in 1954 as being due to a deficiency in pyridoxamine vitamin B6. Isoniazid is rapidly and completely absorbed with low protein binding. Its metabolism is subject to the polymorphic acetylation with fast and slow acetylators having half-lives between 1 and 4 hours respectively. The toxic mechanism of action and in chronic therapy, it produces a pyridoxine deficiency by increasing the renal excretion of pyridoxine. In addition, it inhibits pyridoxine kinase, the enzyme responsible for the production of pyridoxal phosphate, which is the active form of pyridoxine. Pyridoxal phosphate is a cofactor in the synthesis of GABA, a major inhibitory neurotransmitter of the central nervous system. Resulting from an isoniazid-induced pyridoxine deficiency is a major factor in the pathogenesis of isoniazid-induced seizures. Action of pyridoxine: to prevent and treat isoniazid, hydralazine and cycloserine induced neurological disturbances. Acute isoniazid poisoning has been successfully treated with massive doses in grams of parenteral pyridoxine. Pyridoxine is routinely given along with anti-MDR TB regimes. C. Antibacterial properties of pyridine based compounds. As antibiotic resistance becomes an increasingly serious threat to public health, scientists are always out on the lookout for new bacterial invaders. Most of the antibiotics now in use are becoming ineffective against bacterial infections. Therefore, the development of new, more potent antibacterial drug candidates is an urgent medical priority. D. Anticonvulsant activity. Hung et al. 6 carried out structural activity relationship studies on 3,5-pyridine 2-il 2H tetrazole 2-il benzonitrile that led to discovery of 2,2,3-pyridine 3 aloxyl-phenyl 2H tetrazole 5 pyridine, a highly potent and selective mGlu5 receptor antagonist with good brain penetration and in vivo receptor occupancy in rat and cross species oral bioavailability. E. Anti-cancer activity. Benson et al. Synthesized a series of 2,6-diethyl 4-furyl pyridine derivatives and evaluated for their topoisomerase and first and second inhibitory activity as well as cytotoxicity against several human cancer cell lines. F. Antiviral activity. Bernardino et al. Synthesized a series of 4-phenylaminothiono-2,3 pyridine derivatives and evaluated their inhibitory property against herpes simplex virus type 1. All the synthesized derivatives were chemically diverse in nature but showed moderate potency. Antifungal activity. Odesmer et al. Reported a group of 8 novel pyridine derivatives showing antifungal activity when exposed to the panel of 10 human pathogenic candida species. Conclusion. From this we can conclude that pyridine has made tremendous accounts not only in pharmaceutical and agricultural but also in chemistry and is widely used as its scaffold for different poisoning, which is beneficial for our routine. Here are some references links. Acknowledgements. Dr. Shivaji Roy Zondale, President. Honorable Geeta Khare Ma'am, Secretary. Dr. Nitin Mohire Sir, Principal. Thank you.